Sexually transmitted infections, or STIs, are a significant global health concern. Millions of people are infected with STIs every year. These infections can have serious consequences for an individual's health and well-being. STIs can lead to long-term complications. These complications include pelvic inflammatory disease, ectopic pregnancy, and infertility. STIs can also increase the risk of contracting HIV. Despite the serious health risks, STIs often go undiagnosed and untreated. The silence surrounding STIs is a major obstacle to addressing this epidemic. Stigma and discrimination prevent people from seeking testing and treatment. This silence has a ripple effect. It allows STIs to spread more easily and silently. We need to break the silence and encourage open conversations about sexual health. We must remember that anyone who is sexually active can contract an STI. It is important to practice safe sex and get tested regularly. Early detection and treatment are crucial for preventing the spread of STIs and protecting sexual and reproductive health. We must work together to create a world where everyone has access to the information and resources they need to stay healthy. This is a call to action. We must prioritize sexual health and invest in research, prevention, and treatment programs. By working together, we can overcome the challenges posed by STIs and create a healthier future for all. Scientists are constantly working to develop new strategies to combat STIs. One promising innovation is doxycycline post-exposure prophylaxis, or DoxyPEP. DoxyPEP involves taking the antibiotic doxycycline within 72 hours of potential exposure to an STI. This approach aims to prevent infection by targeting bacteria commonly associated with STIs like chlamydia, syphilis, and gonorrhea. DoxyPEP has shown promising results in clinical trials. Studies have demonstrated its effectiveness in reducing the incidence of syphilis and chlamydia in men who have sex with men. This breakthrough has the potential to revolutionize STI prevention. The Centers for Disease Control and Prevention has issued guidelines for DoxyPEP use. Currently, the CDC recommends DoxyPEP for men who have sex with men and transgender women who have a history of bacterial STIs in the past year. The CDC's endorsement of DoxyPEP highlights its potential as a valuable tool in the fight against STIs. DoxyPEP is not a magic bullet, and it is essential to use it responsibly. It is crucial to consult with a healthcare professional to determine if DoxyPEP is appropriate for you. They can provide personalized guidance and address any concerns you may have. While DoxyPEP represents a significant advancement in STI prevention, it is important to acknowledge its limitations. One significant limitation is that DoxyPEP is not currently recommended for everyone. More research is needed to determine its effectiveness and safety for cisgender women, transgender men, and individuals assigned female at birth. Another area of concern is the potential for antibiotic resistance. The widespread use of antibiotics can lead to the emergence of drug-resistant bacteria, making infections more difficult to treat. Researchers are actively monitoring the impact of DoxyPEP on antibiotic resistance patterns. Furthermore, DoxyPEP may have potential side effects as with any medication. Some individuals may experience gastrointestinal discomfort, skin sensitivity, or other side effects. It is crucial to discuss any potential risks and benefits with your healthcare provider. It is also important to note that DoxyPEP does not protect against all STIs. It is essential to continue practicing safe sex, including consistent condom use, and to get tested regularly for STIs. As we strive to develop effective STI prevention and treatment strategies, it is crucial to prioritize inclusive research. For too long, certain populations have been excluded or underrepresented in clinical trials and research studies. This lack of representation has resulted in significant gaps in our understanding of STIs and their impact on diverse communities. Inclusive research means ensuring that studies include participants from all backgrounds, genders, sexual orientations, and racial and ethnic groups. By capturing the diversity of human experiences, researchers can gain a more comprehensive understanding of STIs and develop interventions that are effective for everyone. Participatory research is another essential aspect of inclusive research. This approach involves collaborating with communities throughout the research process, from study design to data analysis and dissemination. By engaging with the communities most affected by STIs, researchers can ensure that studies are relevant, culturally sensitive, and address the specific needs of those communities. Section 5. The unseen majority, cisgender women and STIs. Cisgender women represent a significant portion of the population affected by STIs. They are disproportionately affected by the long-term consequences of these infections. Despite this, they have historically been underrepresented in STI research. Chlamydia is one of the most common STIs, and it can have serious implications for women's reproductive health. Untreated chlamydia can lead to pelvic inflammatory disease, which can cause chronic pelvic pain, infertility, and ectopic pregnancy. Gonorrhea is another STI that can have serious consequences for women. If left untreated, gonorrhea can also lead to pelvic inflammatory disease, as well as increase the risk of HIV transmission. It is essential to prioritize research that focuses on the unique needs of cisgender women and their experiences with STIs. Section 6. Breaking barriers, addressing inequities for transgender individuals. Transgender individuals face unique challenges when it comes to sexual health. They may experience discrimination and stigma in healthcare settings, making it difficult to access testing, treatment, and prevention services. Furthermore, transgender individuals have been historically underrepresented in STI research, leading to a lack of knowledge about their specific needs. Transgender men, for example, may be at increased risk for STIs due to a variety of factors, including hormonal therapy and anatomical differences. However, there is limited research on the effectiveness of STI prevention and treatment strategies specifically for transgender men. Similarly, transgender women may face unique challenges related to hormone therapy and sexual practices that can impact their risk of STIs. It is crucial to conduct research that addresses the specific needs and experiences of transgender individuals to develop tailored interventions that are effective and culturally sensitive. Section 7. Confronting racial disparities in STI research. Racial and ethnic disparities in STI rates are a persistent public health concern. Black, Latinx, and indigenous communities experience disproportionately higher rates of STIs compared to other racial groups. These disparities are rooted in systemic inequities, including poverty, lack of access to healthcare, and social determinants of health. Addressing these disparities requires a multi-pronged approach that tackles the root causes of inequity. This includes increasing access to quality healthcare, addressing social determinants of health, and promoting culturally competent care. It also means prioritizing research that investigates the factors contributing to racial disparities in STI rates and develops interventions that are tailored to the needs of diverse communities. Section 8. A global call to action, investing in STI solutions. STIs are a global health issue that requires a global response. The World Health Organization has called for increased investment in STI research, prevention, and treatment programs worldwide. This includes strengthening healthcare systems, expanding access to testing and treatment, and addressing the social and economic factors that contribute to the spread of STIs. Investing in STI research is crucial for developing new and innovative prevention and treatment strategies. This includes research on vaccines, microbicides, and other biomedical interventions, as well as behavioral and structural interventions that address the social and environmental factors driving STI transmission. Section 9. The Path Forward, Collaboration, Equity, and Hope. STIs continue to pose a significant threat to global health, but there is hope. By working together, we can overcome the challenges posed by STIs and create a healthier future for all. This requires a multi-sectoral approach that involves governments, healthcare providers, researchers, community organizations, and individuals. We must prioritize inclusive research that addresses the needs of all communities, regardless of gender, sexual orientation, race, or ethnicity. We must also address the systemic inequities that contribute to STI disparities. By investing in research, prevention, and treatment programs, and by promoting open and honest conversations about sexual health, we can break down stigma, empower individuals to take control of their health, and move towards a future free from the burden of STIs.